Are you wearing personal protective equipment as a first responder or frontline healthcare professional? Are you wondering if your PPE is aggravating underlying health conditions and increasing symptoms of fatigue, headaches, pain, and stress? Is PPE causing psychological discomfort such as anxiety and loss of focus? Virtue Medicine specializes in the care of essential workers and can help with assessment, diagnosis, and treatment. During COVID-19, essential workers are using personal protective equipment for unreasonably long days and in unusual circumstances. The necessity of gowns, masks, shields, goggles, gloves, and other equipment to protect you is not in question, but your PPE is not benign. Many are finding that there are consequences that have been minimized or overlooked, and providers with underlying physiological and psychological dysfunction that was previously silent or minimally bothersome under normal circumstances are now even more strained. We now know that N95 respirators and surgical face masks create a microclimate surrounding the nose and mouth with increased carbon dioxide retention. This microclimate creates a cascade of sympathomimetic distress mediated by diminished oxygenation and a variety of hormonal responses. These are resulting in elevated heart rate and respiratory rate, heart rhythm changes, and elevated blood pressure. Psychologically, wearers experience conscious discomfort with the cognitive and emotional impact of elevated sympathetic distress and feelings of anxiety and isolation. The research behind these symptoms shows us that PPE also interferes with biomechanical processes of normal breathing. The scientific literature has demonstrated that these include changes in cervical and thoracic mobility and motor control, which impair normal breathing mechanics by reducing diaphragm mobility and strength. This loss of functional breathing mechanics results in reduced ability to regulate intra-abdominal pressure, poor spinal support and postural stabilization, and even diminished muscular and motor control of the extremities. This is increasing the risk and emergence of headaches, neck and back pain, and even pelvic floor pain and dysfunction. So what can be done? If you or someone you know is using PPE and experiencing any of the described symptoms, mental and physical wellness must be addressed directly. This requires an identification of personal risks and interventions to protect and promote wellness. As complex as the ventilation interplay between biochemical, biomechanical, and psychophysiological dimensions is, an efficient, experienced biomechanical assessment can address breathing and motor dysfunction with 89% certainty. This can help protect and reinforce effective habits while identifying and correcting dysfunctional breathing patterns that lead to physical and psychological distress. Personal protective equipment may be necessary, but the decline in musculoskeletal health, breathing efficacy, and autonomic regulation is not inevitable if proper assessment and treatments are initiated for care. Call Virtue Medicine today for this essential mind-body care during the COVID-19 pandemic. Our Doctors for Doctors program is online and telehealth-based. We offer highly experienced biomechanical breathing and musculoskeletal assessments with compassionate and caring treatment for essential workers across the country who are supporting health and infrastructure. Contact us now and ensure you are at your physical and psychological best when those you care for need it most.